everyone. How is everyone doing? Good morning, good afternoon, good evening, good night. Whatever your time is, just take which one applies to you. It's your girl, your woman, your sister, your aunt, your colleague, Lady Sweets of USA. I'm gonna start by appealing to you guys to please share my video and subscribe to my YouTube channel. I'm bringing you another good topic today. You know, my YouTube channel, as I've always said, is about cancer and mental health. The last time I spoke about cancer, and now I'm going to talk about mental health. And I'm bringing you a very interesting topic today. Let me turn down my music. Let me just turn it off. Okay, bringing to us a very interesting topic today. The topic of today, first and foremost, please, guys, share me out, share your sister out, share your friend out, share your auntie out, share your colleague out, please. It doesn't cost much to share. Just subscribe and share it out, please. This topic that I'm going to discuss about today is very interesting topic. It applies to everyone. If it's not you that is having the disorder, it might be somebody in your family that has the disorder. With everything going on these days in the whole world, you can really, you can relate with this topic, with social media, fake life here and there and everything, so you can relate with this topic that I'm about to talk about. Please, you guys need to share out my video. Let this particular one go viral. Okay, what are we talking about today? I am going to talk about pathological lying and compulsive lying. They are the same thing. You can use them interchangeable. Anyways, this topic is a very long one. For that reason, I am going to break it down into two parts. I'm going to make one part today, and then I'll do another part whenever I can. I was hoping I could drop one video a week, hoping that each week I will drop one video in my YouTube channel. But unfortunately, I have not been able to do that because I run a very, very, very tight schedule. So it's really hard for me to do that right now. But I'm going to try as much as I can. So, whenever I can, I drop a video. I will do this part one, and I'm going to try next week the most. I will try and drop part two, so that you can just have the follow-up. Pathological lying and compulsive lying. Is it that interesting one? Anyways, my YouTube channel, let me just tell you guys about my YouTube channel. Is Lady Sweet of USA. Lady Sweet of USA, that's my YouTube channel. Oh, my earrings just fell off. Okay, we gotta take care of cosmetic first, the wardrobe. Anyways, what is pathological lying or compulsive lying? Do you know anybody that has the spirits of lying, that lies all the time? Everybody lies. Everybody lies. Even me too, I lie. Nobody on this earth that has never lied. Sometimes you lie to get yourself out of trouble. Sometimes you lie to protect your loved one. There's white lie, there's little lie, there's big lie. But when it comes to pathological lying and compulsive lying, this is something that people do. They just do it. It's a habit. It's a habit that people just. I'm in the car, so let me just close my windows. When it comes to pathological lying, people just lie. The person just lie for no reason, So I'm going to talk about this so that you guys will know what this is all about. And then when you see somebody that has that trait, that behavior, you are well informed that you just say, "Oh, this one has a disorder. There's no need to judge them. Just let them be." Or you can help them by correcting the behavior. And then sometimes it's good to even seek treatment for it. At least when you know a lot about pathological lying and compulsive lying, you are well informed. It's just like when a doctor is about to perform a procedure on a patient. Let's say you're going in for a surgical procedure. The doctor, the surgeon who is going to be operating you, have to talk to you about the procedure. Okay, let's say you're going in for a C-section, for example. The doctor is going to tell you the risk and the benefits of these C-sections. The benefit is that your child they're gonna bring your child out. Your child is not going to die in the stomach because you're trying to push and the baby's not coming out. You are not dilating. The child might end up losing oxygen and die. So now they have to operate it and take it out. Or you have other pregnancy complication that if they don't do this C-section, you either gonna lose your life or your child is gonna lose his or her life. So they will tell you, and they will tell you the risk. The risk is the most risk with surgery, with surgical procedure, is like you might lose a lot of blood, you might get infection. So they will tell you that this is what to watch out for. When if it's infection, they will tell you it's gonna be warm to touch, you're gonna be running temperature, it's gonna be painful. They will tell you what to watch out for. There might be pulsy drainage from your incision site, stuff like that. And when it comes to losing of blood, they will tell you, they will figure out your genotype, your blood type, and everything down in case if you need blood transfusion, they'll be able to give you. After the surgeon has explained this whole thing to you, and they will explain it to you in a layman's language. They will not use too much medical terminology if you are not in the medical field, so that you'll be able to understand. Because when they're explaining this thing to you, they're going to give you a paper to sign. That paper, when you sign it, it means you understood everything that the doctor just explained to you. So now I want to talk to you about compulsive and pathological lying, so that you will be well informed when you see somebody in social media, see somebody out there who is lying. Just lie. Everybody say this person is a liar. So you know that, oh, this person have this disorder, this person have this trait. They honestly, sometimes they cannot help it, because this is a behavior that have generated right from when they were little kid. Okay, so you don't expect them to now change. Now you just either accept them for who they are, or you stay away from them. Okay, enough of that explanation. Let's dive into it. Pathological lying, it does have a psychiatric name for it. It's also known as mythomania and pseudological fantastica. Gano. Compulsive lying is also known. It's a known trait. It's a known trait that is of some personality disorder. Compulsive lying. Somebody that has compulsive lying has a personality disorder that is called antisocial personality disorder. What is an antisocial personality disorder? Oh God, no. Oh, this is too much grammar. But when you say antisocial, it doesn't mean that they don't like going out. People used to think when you say antisocial, means they don't make friends or stuff like that. No. Somebody with I'm gonna bite my tongue. Yeah. Somebody with antisocial personality disorder, which is sometimes called sociopath, is a mental disorder in which a person consistently consistently, which means always, all the time, shows no regards for right or wrong, and ignores the right and feeling of other people. They do it consistently. They don't even care who they are hurting, who they are not hurting. They just do it. It helps to build their self-esteem. It makes them feel better about themselves. They are full of a lot of egos. Everything has to be about them. People with antisocial personality disorder tend to antagonize, like, always looking for trouble, people's trouble. You don't even have to do anything. You don't even have to offend them. They always come for you. They like to antagonize. They like to manipulate or treat others harshly or with callous indifferences. They will antagonize you. They are very, very manipulative. They are very, very manipulative. They are working with manipulation. They know how to manipulate. They have disregard for other people. They don't care they don't care anything about that person. It's always about them. Everything has to be about them. You know what I mean? They show no guilt. They don't have any guilt or remorse for their behavior. That's the difference between them and somebody that doesn't have this antisocial personality disorder. The person might do something and say, "Oh, I'm sorry," but somebody that has antisocial personality disorder does not say sorry. No, does not show any remorse. It's careless. It doesn't mind. It doesn't mind hurting your feelings, so as long as he or she feels fine. It's all about them. Individuals with antisocial personality, they are very, very full of themselves. You know what I mean? Okay, that's enough about antisocial. So just know now, anybody that is a compulsive liar or pathological liar, which they are the same thing, you can use them, like I say, interchangeably. You can use them like that. So that person has antisocial personality disorder. And also, they say sometimes, I've looked into a lot of research about this pathological lying, compulsive lying. It says sometimes it could be caused by trauma to the head. Maybe somebody suffered head injury and they never got treatment for. That can lead to somebody having a pathological lying trait. Also, they say some abnormality in one's hormones can also lead to that as well, and this thing starts from a very young age. I thought I locked that window, but I guess no. Let me lock my second window. Sorry guys. Okay. Let me rephrase that. The people with compulsive or pathological lying behavior, according to research, majority of them has antisocial personality. Some is caused because of health injury. Maybe they were involved in a car accident and they never got treatment, and progressively they become, I don't even know how that's related, but that's what I've seen in research that I've done, that I've most of the research that I've found said antisocial personality disorder, they are compulsive liars, they are pathological liars, and also people with head injury that never got treated can develop the trait of lying, of being a compulsive liar. And they say some hormones can also, abnormality in the hormone can also lead to compulsive and pathological lying. Okay. Compulsive liars, they know that they're lying. It's not as if they don't know that they're lying. They know that they're lying, but they just can't help it. They will tell this lie, tell another lie to cover that lie, tell another lie to cover that lie. Everything, they lie about everything. Sometimes you just ask them, what are you doing? They are lying down on the bed sleeping, not sleeping. They're lying down on the bed, but they'll say, "Oh, I'm washing dishes in the kitchen, or I'm sweeping, I'm cleaning the house." They don't even have reason to lie. People that are not compulsive liars, people that are not pathological liars, they can lie to get out of trouble. But somebody with the traits, with the behavior, with the attributes of compulsive and pathological lying, just lie. They don't even know how to tell the truth. Isn't that interesting? So, you know, when you look around you, you might have one in your family. You might even be you yourself that have that trait, that behavior, that you can't even help it. There are treatment out there. I don't know about Nigeria, but like in Western world, in the US where I base, there are treatment for it. You can go. They can do like talk therapy, CBT, cognitive behavioral therapy. You can do those to kind of, you know change the behavior, change that destructive uh thinking, you know those thoughts. You can do therapy for that. Sometimes they use medication as well for the treatment, but you have to be seen as a psychiatrist to be able to um you know give you medication for that. They say sometimes when people are depressed, it does lead to it as well, so they'll give like an antidepressant that might also help with it. um what else do I need to tell you guys? I'm running out of time. Compulsive, okay, let's say for example, people out there in social media, living what you guys call fake life. You people see it as a fake life, but to them it helps to build their morals, it helps to build their self-esteem. It makes them feels good. you know they can go to any lengths. It doesn't mind even if it's affecting their husband, even if it's affecting their wife, even if it's affecting their children, their entire family can talk from now till they turn blue. The person doesn't care, because the person is having that adrenaline that is making them feel happy, feel like they're on top, you know, making up all these stories, all these lies, and they are very, very believable. A compulsive liar or a composer, when or she is telling these lies, you know, the story is believable, but it's all lies. By the time you start finding out this, everything that person is saying is lies, all lies upon lies on lie. They don't. Sometimes, let me give an example. There was one situation we had in the US here. Somebody lied, it's a white woman, that she had cancer. Who wishes themselves cancer? That she has cancer, just to elicit favor, sympathy, you know, make them get all those attention that they have, just to make her get all those things. She lied that she had cancer. People were feeling so sorry. Even the fiance actually thought she had cancer. She go hello boy, she go drive come on for her, say she want to go and do chemotherapy. 3 days a week she go. That in fiance want go do therapy. That one, the fiance actually thought she had cancer. Okay, when you do chemo, the most side effect for chemo is people lost their hair. This somebody do chemo, no, they lost hair. Anyways, long story short, and people are donating money to her and everything, GoFundMe and all that. Long story short, to find out she didn't have no cancer, no terminal disease. So that is a typical example of somebody with compulsive and pathological lying disorder. You know, they will lie just to get sympathy, not necessarily favor, but sympathy, attention. They always want to be on the spotlight. They will do anything to be on the spotlight. You that is their relative, you that is a family member, you are ashamed, you're shy, you're like, oh my god, why is she behaving like this? That person doesn't care. You just be there, be shaming. They are ashamed for them. They are not ashamed. They continuously do it. So the earlier you know this person is a pathological liar, the earlier you know this person has a compulsive lying behavior trait, the better for you. So when the person is talking, like, oh wait, oh, you know, she's lying again. You know what I mean? So I'm going to end this here for now, and I'll continue sometime next week. I'll title this part 1. I'll continue with part 2 next week to talk about the treatment that we can do for it, you know, and how to cope. If you have a friend, you have a loved one, a spouse, a child who has these traits of lying, we will talk about how to cope with them, you know, how to manage them and stuff like that. Okay, thank you very much. Please continue to share my video. Wala wo wo. I use God tebeguna. Wala, please share my video. Uh, subscribe to my YouTube channel. You know, so that I want to be able to be doing my video there live. I know I can do it live if if I want to do it with my laptop. I just can't do live with my phone. But then, please, I need more subscribers. I need to hit 1,000 subscribers. Please, don't forget, this is me again. Oh, look at me. This woman that make age 50 looks like she's 30. You know, come, ask me. Let me tell you the secret of looking this young and this good. Anyway, thank you. I love you guys. Bye for now. God bless.